source material. So it won him the Israel Prize, as you may well know. So he quotes an interesting idea that there is a notion that schar batola is that if I have another occupation and I then choose to do some medicine along with that, then I'm entitled to be compensated for my time away. But what if I dedicate myself to medicine? That's all that I do. So schar batola means that I'm getting paid for just being available so that I can take care of patients. Otherwise, the community would be bereft of physicians. Namely, it's like the concept the Mishnah has of the Asara Batlonin. The Mishnah has a concept that if a synagogue is having trouble having a minyan, so they hire 10 people to do nothing else but be available in the synagogue to ensure a minyan. So they're getting paid just to be available. So that's what the doctor can be paid for. He can be paid for being batal, namely the fact that the physician dedicates his or her life to medicine rather than becoming a successful attorney or some other profession where he would rightfully be able to be compensated appropriately. He's dedicating himself and he's being mevatel. He's not following another pursuit. So that gives the community the right and the obligation, the community the obligation to support such people. It's the same concept as justifying the salary for Rabbanim. That if Rabbanim would not get paid, so then the community would be bereft of Rabbanim. So who would give sermons, who would teach, who would educate, who would decide various questions that come up, who would counsel. So the community needs rabbis, it needs physicians, it needs circumcisers, molim, it needs all kinds of people. So the community therefore requires to be able to do so that people be dedicated to these fields. And in order to facilitate that, the community then has to provide basic salaries, basic sustenance. Question then becomes what's considered a basic salary and what's considered to be minimal requirement to support an individual. Well, those are some of the questions that come up. I just want to share with you, based on our discussions, something that's very relevant. It says in Shulchan Aruch in the laws of Milah, of circumcision, that ha'av she'eino yodea lamol, that if a father doesn't know how to circumcise his son, and most fathers do not know, and even if they do know, most of them are too nervous at the time, and it's not recommended these days that fathers circumcise their own children. But in either case, let's say a father would want to theoretically, or he's confident and he's comfortable in doing so, so that would perhaps, according to some Rishonim, be the ultimate fulfillment of the mitzvah, that the father performs his own circumcision for his son. But the father doesn't know. V'yesh kan mol, and there is a mol available, she'eino rotze lamol b'chinam, but he doesn't want to do it for free. He wants to do it, and he wants to get compensated for it. So yesh lebezdin ligor b'mol zeh. So first of all, the community and the body that represents the community, the rabbinic board of the community, is supposed to discipline this moel and teach him ki ein zeh darkan shel zera Avraham, that this is not the manner in which the descendants of Abraham act, that we refuse to take care of somebody and perform a mitzvah of milah, of circumcision, because the person doesn't have the means or the will to be able to pay for it. V'adarabba, on the contrary, he talks about the moelim sometimes used to pay to be able to have the privilege to perform circumcision. That's a new concept maybe that can address the physicians should pay for the privilege of taking care of it. May solve some of the economic burden.
Soon the HMOs will pick that up. Physicians would argue that they do.
So v'imomed b'merdo. So what if this moel is reticent and he does not heed the words of the bezin and he still wants to be compensated? So this is the most important point. Ve'in yadhu ish maseges, and the gentleman who just had his first child doesn't have the means with which to pay. So then it says in the Ramah, Havi k'mishein lo av shebezdin chayavim lemolo. Then the community becomes the ones responsible for the circumcision. Then Bezdin has the right to enforce their law and to see to it that this moel does perform the circumcision, becomes a communal obligation. That notion is quoted in terms of medicine as well. It's Dr. Abraham, who wrote another excellent series of works that again, if you're interested in Jewish biblical ethics, you should be in ownership of, and I think it's also been translated by himself into English. I think he's finished all the volumes, and it's a very different style and very different layout than Dr. Steinberg. So those two works together really give you a full complement of Jewish bioethics. So they talk about the fact that as a physician, as a healthcare worker, I'm entitled to some compensation. At the very least, for effort and for batala, for not being engaged in some other activity, whatever that would amount to in terms of a dollar figure. I'm entitled to something. But the truth is that if a person doesn't have the wherewithal to pay, then I'm still obligated, I have a mandate to treat someone based on the 3 verses that we began with. So, and if I decide not to, at the end of the previous discussion, the rabbi quoted from the Mishnah at the end of Maseches Kedushin of Tov Shebarofim LeGehinnom, that the best of the physicians end up in purgatory, in Gehinnom. So Rashi there on the Gemara explains part of what that means is that if an expert physician has apparently the wherewithal, perhaps financially as well as expertise-wise, to treat the aniyim, the indigent, the truly indigent, and he chooses not to. So that's what the Mishnah means, Tov Shebarofim LeGehinnom. If a person has the capacity to treat the indigent and refuses to do so, that physician is condemned to purgatory, to Gehinnom. The Rav Waldenberg one of the chief rabbis, one of the prominent rabbis on the Rabbanut in Yerushalayim, talks about this notion as well, and that the Bezdin, the community, becomes obligatory. And he quotes an interesting practice from an earlier work a couple hundred years ago, if I'm calculating correctly. He quotes the following. He quotes from a rabbi physician in Jerusalem, Rabbi Rafal Malki, who says, Mitikun hatzibur, some of the institutions of the community require, b'chol makom u'makom sheYisrael yoshvim liyachid kupa l'bikur cholim, to collect, put together, to accrue a collection, a fund for visiting the sick, meaning v'hu shehacholim ho'aniyim, those who are truly indigent. And I keep using the word truly indigent because Dr. Jacobs touched upon the etiologies of the uninsured. And there clearly is a group that are uninsured because of being truly indigent. There are, though, other categories of people who choose not to pursue health care, and that, I think, requires a different analysis, because I'm not convinced, I'm not sure, and I'm not convinced that the same analysis that we're presenting here for the truly indigent can automatically be applied to those who willingly choose not to become insured. On the contrary, one could suggest that not becoming insured when one has the capacity to do so and chooses not so is a violation of halacha. It's not just a privilege I have to choose to be insured. According to Torah mandate, Rabbi Bleich makes this point, that a person on a certain level has an obligation to become insured, because without insurance, as Dr. Jacobs presented, the difference between health care provision, the difference between ability to address catastrophic illness and delay of diagnosis and the burden of disease is increased, and therefore I am actually jeopardizing my health care if I don't engage in a health care insurance plan, so that on a certain level Judaism would mandate that every person not has the right to health care has an obligation to pursue health insurance, unless the person doesn't have the ability. In that case, the community, just like by the moel, by the circumciser, has the obligation to step in and to try to see to it and facilitate. So he quotes this practice, Rabbi Waldenberg does, from a few hundred years ago, Mitikun Hatzibur, that they should create a fund for the community, that don't have the capacity to pay, that the hakahol sholchim lehem rofei, that the community sends a physician levakram to visit them, v'harefuos mikis hakahol, and the expenditures come from this communal fund. V'nostem lehem mozon haroi lehem. That's what he talks about, this notion of this communal, socialized type of system where the community takes care of the truly indigent. It's interesting to really go back to the beginning of Jewish bioethics. This book is, I think, still the classic book in Jewish bioethics, and I think it will always be the classic book in Jewish bioethics, written by the founding father of Jewish bioethics, Rabbi Lord Emanuel Jacobowitz. See, he wrote his PhD thesis in the 1950s on Jewish bioethics, and he really started the field of Jewish bioethics. In the secular world, there's differences of opinion who's the father of secular ethics. But in Judaism, I don't think there's any dispute that it was Lord Rabbi Emanuel Jacobowitz. And if you look at his book, written in the 50s, and then